So, hi, this is Dr. Blan. I'm fellow in Park Avenue LASIK in Dr. Chynn office. So, we are doing this kind of new things so that the patient is asking questions and Dr. Chynn is talking about that. Okay, here's Dr. Chynn, and the patient is going to do the question.
Yeah, so the smarter questions, we're going to do it this way because, you know, I'm saying they come up with amazing questions. So go ahead.
Well, since most of my basic questions are answered by the previous
You got to watch the
staff
surgery,
and
right?
the
Yeah.
doctors. So, well, I have this instrument-related question.
Yeah.
Because it looks like instrument is doing.
Yeah, you asked the
the
difference
job,
between LASIK
right.
and epi or whatever.
Right,
So
right.
what's your question?
Is the laser that you use and the instrument that you use, the wave scan, are they like standard across?
Okay, right, that's a good question, okay? So basically, the thing that sets our practice apart is that we're taking off the epithelium instead of cutting into the cornea.
Right.
It's safer if you get punched in the eye afterwards, you don't have to worry about a flap coming up. And we have the only glass operating room in the United States. That's because when I was doing LASIK with the cutting flap, I couldn't have a glass operating room because I could be the best surgeon in the world, and sometimes the flap goes wrong. It's a mechanical cutting process, and then they don't see well, and you can't have a glass OR for that because then you might have a bad case, okay? Because we're not doing that step anymore, we went like all glass operating room. So we take off the epithelium one of two ways. Either we take it off with an alcohol solution that's called LASIK, or we take it off with an epikeratome. We have the only epikeratome in, I think, on the eastern coast of the United States. So nobody else can do an epi-LASIK because it's a special device that I spent $50,000 buying, okay? That takes off the epithelium in one clean sheet. Both of these methods are different than PRK. PRK, you take off the epithelium, but you kind of grind it away. That causes like pain,
So the
inflammation, and
epithelium
scarring.
is sort of like your skin.
It's the skin of your eye.
Grow back.
It grows back. That's the beauty of the safe site procedure. Okay?
And there's no like scar or anything.
Yeah, the beauty of this procedure is if there's, let's say, something going wrong with the taking off the epithelium thing, whatever, it doesn't matter because it's going to grow back. The skin grows back no matter what.
Right,
So
right.
it's a kind of a risk-free thing because we're operating on the part of the body that just grows back by itself.
Right.
Okay, when you cut a flap and you get a messed up flap, which sometimes happens, that's messed up for the rest of your life. Your cornea's got no ability to regenerate, which is good because if it did, when you laser off the prescription, it would come back. Okay.
Because the flap, what goes?
The flap is
cornea.
the flap is a cornea flap. Okay, so if you have a problem with a cornea flap, because the cornea has no ability to regenerate, you have that problem for the rest of your life. Okay, so our procedure is much safer, and also the final vision is better. Okay, because when you cut a flap, you have a flap for the rest of your life. I have seen people poked in the eye, minor trauma like basketball. 5 years later, the flap comes up. Okay, they just got unlucky because the guy's fingernail just hits the edge of the flap. Anyway. The flap's going to be in two pieces, so when the light comes through, the interface is never healed, and you get some backscatter. That's
so
why
is it like a crack?
it's a crack. It's like a crack in the cornea.
in the
Okay,
cornea.
so that's why I have bad night vision because in daytime I don't notice. At nighttime the light comes in, I'm like, whoa, it's really bad night vision. Okay, since I went flapless, the night vision problems have gone away. Okay, so it's not just the safety in the operating room. It's not just the safety when you get poked in the eye. You would have final better vision for the rest of your life. The only downside is the healing does take a little bit longer.
So what makes the slow recovery?
Well, the slow recovery is because when you do a flap, you're taking that skin off with the flap.
So it's the healing of the skin.
It's the skin healing.
But then the vision also improves over time.
Okay,
right?
these are related
So,
things. Okay,
right,
so
right.
basically, when you take a flap off, when I was cutting flaps, you take off the flap, the skin comes up with the flap, it goes back down with the flap,
Right.
and the only part it has to heal is the edge, which is like a millimeter. It's like a day. Okay, so I saw well the next day, and when I was doing LASIK, they see well in 1 to 2 days. Okay, but then they stop getting better because everything's done. The safe site procedure that we're doing a surface ablation, the skin has to grow back, and it takes a few days to grow back. Now, PRK is horrible. That takes like a week. I'm in pain. My fellow that made him PRK, agony, okay? So the LASIK procedure, safe site, it takes like a few days. There's no pain. And then epi's even quicker, okay? But then because the epithelium is growing back, initially when it grows back, it's not totally smooth. And then it has to get smoother and gets better. That's why LASIK, you get your final vision in a week or something. You don't get your final vision in this procedure for like a month. So you catch up with LASIK in about 2 weeks, like you get to 20/20 in 1 to 2 weeks or something, but then you keep getting better. So when I was doing LASIK, about maybe 20% of my patients were better than 20/20. Now it's like maybe 40%. It's almost 50%. It's like very, very close that 50% of the patients are 20/20 and 50% of the patients are better than 20/20, but it might take them a month to get there. You should probably cut it, and then we'll do another one.